Welcome to the Insight series on personal well-being. Our question for this week is, Wellness Big 10, what about heart health? Number 14. What about heart health? The Centers for Disease Control and Prevention says heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 33 seconds in the United States from cardiovascular disease causes. About 695,000 people in the United States died from heart disease in 2021. That's 1 in every 5 deaths. CDC also says about half of all Americans, 47%, have at least one of 3 key risk factors for heart disease. That includes high blood pressure, high cholesterol, and/or smoking. Now, the factors that are associated with heart disease are 1, your age. The risk of heart disease goes up as we age and get older. Sex is also a major factor, and that's some factors may affect heart disease risk differently in women than in men. And family history and genetics are also important. And a family history of early heart disease raises your risk of heart disease, and research has shown that some genes are linked to a higher risk of certain specific heart diseases. Race and ethnicity is also an issue, with certain groups having higher risk than others. And lifestyle habits, over time, unhealthy lifestyle habits can raise your risk of heart disease. These include things like eating a diet high in saturated fats, refined carbohydrates and/or salt, not getting enough physical activity, drinking too much alcohol, smoking and exposure to secondhand smoke, too much stress. Having other medical conditions can also raise your risk of heart disease. These conditions include high blood pressure, high cholesterol levels. These two, by the way, are oftentimes things that we put into preventive screening programs for employee populations. Diabetes, type 1 and type 2, obesity, the autoimmune and inflammatory diseases, chronic kidney disease, and metabolic syndrome. So in summary, heart health and heart disease prevention are a major concern for all adults, and there are a number of modifiable risk factors that can be reduced through wise lifestyle choices. Personal well-being requires that we monitor the major factors associated with heart disease and take action to improve our heart health. Now, for more information on this topic, put these terms in your web browser search engine. Tips for avoiding heart disease, strategies for preventing heart disease, and the prevention of heart disease. Next week, we will address the question, Wellness Big 10, what about managing my weight? We encourage you to live well, live wise, live long.